Health workers will be given new guidance to help them identify signs of human trafficking and exploitation among patients. The guidelines include advice to help frontline health professionals know what action to take if they have concerns. The plans come as more victims of human trafficking and exploitation are being identified in Scotland than ever before. In the first 6 months of 2019, 188 victims have been identified, a 74% increase on the same period last year. Health Secretary Jeane Freeman said, "Any form of human trafficking or exploitation is completely unacceptable in 21st century Scotland. Victims of trafficking and exploitation can be severely traumatised by their experiences and can find it extremely challenging to share their fears. They may also be distrustful or anxious about contact with authorities." While many healthcare workers may be unfamiliar with indicators of human trafficking and exploitation, practitioners have a unique and vital opportunity to manage individuals who may otherwise attempt to avoid services. This guidance is intended to support healthcare workers in recognizing and responding appropriately to victims of this abhorrent crime. Health bosses say that, given the health risks associated with forced labor and sexual exploitation, NHS staff are in an ideal position to spot and support victims to get the help they need. Guidance on human trafficking and exploitation for all healthcare workers was first published in 2012 before the Human Trafficking and Exploitation, Scotland, Act 2015 and publication of the Statutory Trafficking and Exploitation Strategy in 2017. The updated guidelines reflect these changes and the increase in the number of victims being identified across Scotland. Risks for trafficking victims include exposure to infectious diseases, repetitive physical, sexual and psychological abuse and chronic deprivation of food, sleep and shelter. For more on this story, visit the news article link.